Hello and welcome to another episode of Health Matters. I am Dr. Chillemi, and on this episode, we're going to give you a general overview of the knee. And when I say a general episode, I'm going to title this actually All Knee All the Time, diving into the knee joint. So, a general overview, what does that mean? So, what that means is we're going to embark on a deep dive into the knee, understanding the full capacity of what the knee joint is, the structures, common injuries, inflammatory conditions that affect it, and we're going to explore breakthrough treatments that are available today. So on this series, I'm going to call it a series because we're going to be really getting into the details to enlighten you about the marvels and the mechanism of the human body with a special focus on the knee joint. So what I'm also going to be doing is I'm going to be making this a 5-part series that's going to break down first the general overviews. Then I'm going to talk about injuries, inflammatory conditions, other conditions, and breakthrough treatments as far as the knee joint. So on this particular episode, though, I'm going to give you a general overview. So as if you know nothing about the knee, I'm going to give you everything you need to know. Okay, so first, the knee is one of the largest and most complex joints in the body. It plays a crucial role in daily activities, bearing the weight of the body while providing mobility and support. Maintaining knee health is vital and crucial for overall physical health and can help prevent mobility issues later in life. So the better you take care of your joints, the better you'll feel as you age, right? The more we do in the beginning, the better you will be later on. Okay, so let's understand what the knee joint is. Let's break down the anatomy first. So I know this might get a little technical. I'm going to keep it really basic, I promise. I'm going to keep it basic just so you have a basic understanding of what's involved in the knee joint. So in the basic anatomy of what the knee joint is, bones, the knee is formed of 3 primary bones: the femur, which is the thigh bone, the tibia, which is the shin bone, and the patella, which is the kneecap. We also have cartilage, and then we also have meniscus. We have the medial and lateral meniscus. The meniscus is actually the C-shaped piece throughout the middle of the knee, which provides a tough, rubbery cartilage that acts as a shock absorber between the femur and the tibia. Now, the way the whole knee is held together is by ligaments, right? So if you can imagine the knee here, you have ligaments. You have what's the front ligament, which is called the anterior cruciate ligament. Then you have in the back of the knee, which is the posterior cruciate ligament. On the inside of the knee, you have the medial collateral ligament, and on the outside of the knee, you have the lateral collateral ligament. Right? So that makes sense. The front, the back, the middle, and end. So don't forget, your knee joint is, let's say, like this. Not really, but kind of. So it's 2 bones here, right? With a joint in the middle that rotates you, right? So the way it's held together is by ligaments and tendons. Okay. So now if we talk about tendons, we're going to talk about the quadricep tendon. We're going to talk about the patella tendon. Those are the 2 main tendons that are involved in the knee. Then we're also going to have a bursa. What's a bursa? A bursa is a small fluid-filled sac that helps reduce the friction of the body, right, between the bones, right? It's going to reduce the friction. What is the knee function, right? So what's the functionality of the knee? Since the knee is, again, one of the largest and most complex joints in the body, it is crucial for various functions. So the functionality of the knee is weight bearing, right? The knee supports just about the entire weight of the body, both standing and moving, right? So static and dynamic. So whether you're walking or standing still, your knee is responsible for supporting you. The tibia, which is, we said, is a shin bone, and the femur, which is the thigh bone, meet at the knee joint, which is stabilized by ligaments and muscles to manage and distribute this weight efficiently. Mobility. The knee joint allows for flexion, which is bending, and extension, which is a straightening of the leg. It also permits a small degree of rotation and lateral, which is side to side movement, allowing for greater flexibility and adaptation to different terrains during movement, right? So the ability to stop and go if you're exercising, or twist and rotate, that's part of the functionality of the motion of the knee. The support. The structural components, the bones, ligaments, tendons, and muscles, work together to keep the knee stable. Ligaments such as the anterior cruciate, posterior cruciate, help prevent the knee from moving forward and backwards, while the medial and collateral ligaments provide stability against inward and outward forces. So somebody hitting you from the side or somebody hitting you from inside. Okay, next let's talk about shock absorption. We mentioned it in the beginning, but the meniscus, which is two C-shaped pieces of cartilage that act as a cushioning pad between the femur and the tibia. The meniscus helps absorb the impact and shock from activities such as jumping and running. Now, within that, we have something called synovial fluid within the joint, which also helps reduce friction and distributing pressures across the joint surfaces. Now, a question you might say is, what happens if you hurt your knee and you bend it and you have a tear? Does that affect your blood supply? And the reason it doesn't is because nutrient supply for the knee is basically the function of osmosis. Now, what does that mean? So the blood supply of the knee is primarily by blood vessels and synovial fluid. The blood vessels through genicular arteries receive the blood from a network of arteries called the genicular arteries. The arteries are branches of large branches of vessels, such as the femoral artery, and they are divided into smaller arteries. And with that, these arteries ensure that the knee joint structure, including bones, ligaments, and surrounding tissues, get enough oxygen, nutrients to maintain the proper health to facilitate repair and healing. Again, and the way it does that is on the outside of the knee is where these arteries are. And they actually, by osmosis, they push in the fluids from the outside in. Synovial fluid is the viscous fluid around the knee and the synovial membrane of the joint. The fluid has multiple functions. We said it before: lubrication of the joints, reduce friction during movements, and also serves as a medium for nutrients for the cartilage. So the cartilage itself does not have its own blood supply. Along with nutrients, the synovial fluids help remove metabolic waste from the cartilage, ensuring a healthy and functional joint environment. Understanding the functionality and the nutrient supply of the knee is key to understanding the complexity of the knee and the importance of knee health and maintenance through proper care of exercise and nutrition. So what I'm going to do is in the next episode, I'm going to break down injuries, right? So I'm going to talk about different injuries to the first part that we talked about, your ACL, MCL, PCL, LCL, your meniscus injuries. I'm going to do, that'll be the next video that we're going to talk about. So stay tuned, pay attention, and if you're not already, please subscribe to our channel, right? Your support is everything of how we keep going. So again, lastly, the information you have here is my opinions alone. If you have a problem, please see a professional. But stay tuned. Next episode is coming soon.